Okay, so I saw this comment. Can we talk about post-vaginal delivery hemorrhaging because your girl almost died and now I'm scared to have another child? So let's talk about it. Okay, so first, what is a postpartum hemorrhage? A postpartum hemorrhage, regardless of if you have a vaginal delivery or a C-section, is greater than 1 liter of blood loss. And you're probably thinking, like, how much is a liter? To give you some context, this Stanley Cup is a liter. Is that this much blood? Plus or minus, that's subjective, but your body only has about 4.5 of these total. So in the grand scheme of things, when your body is compensating after you deliver a baby, that's a lot of blood to lose. Sometimes you can have a postpartum hemorrhage as the baby is coming out. It happens almost immediately after the placenta separates. So what are things that can happen in the delivery room? The reason I wanted to talk about this is because I realized that in my last video, when I'm talking about pain control and epidural and having this beautiful moment with your baby, a lot of times people have no idea what's actually happening when they're having a postpartum hemorrhage. So what are things that we're doing? Usually the first thing that we'll do is we assess the tone of your uterus. After you have been in labor for a while, sometimes your uterus does not want to clamp down, or what we call contract. At most hospitals, it's standard to give a Pitocin bolus after the baby is delivered to kind of assist in that uterus contracting down. If it's not, we have medications we give, which is probably why when you're admitted to the hospital for labor and delivery and we asked you a history of asthma or hypertension, it's because 2 of the medications that we give, those are contraindications. So when we think about a postpartum hemorrhage, there are usually 4 things we think about. I like to think of them like the 4 T's: tone, tissue, thrombin, and trauma. So we already talked about tone, just assessing the tone of the uterus, making sure the uterus is firm. If not, giving those medications and massaging the uterus to help it clamp down. So let's talk about the next one, tissue. What can happen sometimes is if there's pieces of your placenta left behind, you'll just continuously bleed until those little pieces come out. So that's why you may feel you may feel some pressure, and that's usually us with our hand trying to assess to see, 1, how the tone is, and 2, if there's any tissue of the placenta left. Okay, so the third T is trauma. What trauma refers to is lacerations. In my last video, I talked about how best case scenarios, you have a 2nd degree laceration. And the reason I said that is because that's the most common. Of course, best case scenario is that you have no lacerations, but most women have a 2nd degree. They're fairly common, they're not difficult to repair, and everything heals almost back to normal. But some of those lacerations can cause more what we call brisk bleeding. So if you think about it, after the baby comes out and the placenta is separating, a little bit of bleeding, kind of like the lochia, is normal. But if you see brisk, bright red bleeding like a waterfall, that's kind of your sign that something is not quite right there. And so that's when we'll usually take a look at your cervix. We'll make sure that we're not missing any lacerations. We'll repair whatever lacerations there are to control the bleeding. And then the last T is thrombin, and that basically refers to your body's ability to form clots and coagulate in order to stop the bleeding. And that's kind of like a whole different topic in and of itself. Okay, so what can you do not to be scared about having another child? So something we do in most hospitals is whenever someone comes in for labor, we stratify their risk of a postpartum hemorrhage. Okay, so I just took this table off Google. But this is an example of a postpartum hemorrhage risk stratification table. There's a lot of different things that go into it, and I'm not going to go into all of them. But the reason I want to bring this up is that it is really important, if you're not delivering at the same hospital, to kind of know what happened in your last delivery. The reason I say that is because it gives your doctor an idea of exactly what happened, 1, during your labor, and then 2, in the postpartum period. Oftentimes people think that they may have had a postpartum hemorrhage, but really they were just given what we call uterotonics, those medications I talked about, before they actually had a hemorrhage. So we can give those medications after delivery and someone's blood loss can only be 300, 400, 500. But in the event that you did have a real postpartum hemorrhage, meaning over 1 liter of blood loss, that puts you at a higher risk for having another postpartum hemorrhage. So here you can see that puts you at a medium risk for a postpartum hemorrhage, which means that they would type and screen you. And I think it's just a good thing for your doctor to know so they can be prepared after the delivery. But I really say all of this so that you know that there are resources and things in place that can help you in terms of not being afraid for your next delivery. So talk to your doctor, tell them what happened, tell them your concerns, and when it comes time to have your next baby, they'll be prepared. Bye.